Uh, this young chap has got the problem of cut nose, and I am planning to do cut nose rhinoplasty under regional anesthesia. And the block which I will perform on the face is bilateral infraorbital block, bilateral supraorbital block, bilateral external nasal block, and of course the infiltration at the nasal spine. आँख बंद करो बच्चे, एक सुई लगेगी. Now I am giving the infraorbital block. I am palpating the infraorbital margin and moving my tip of index finger about 4 to 5 millimeter down. Now I am palpating the depression that indicates the infraorbital foramen. Okay, I have taken a 30 gauge needle and I will inject around 0.5 ml of the solution to block the infraorbital nerve. So I have injected about half ml of the solution. This is the infraorbital block on the right side. Just press to minimize the hematoma formation. Now I am palpating the infraorbital foramina just below the midpoint of the inferior orbital margin, and now I am injecting half ml of the solution here. This will block the infraorbital foramen on this side. Now aspirate, fill up the syringe again from the another syringe in which I have taken 5 ml, 10 ml of 0.5% sensor cane and 10 ml plain xylocaine. Now I am going to block the supraorbital nerve. Here I have just put the finger on the superior orbital margin and roll it like this. Now I can palpate notch. That notch indicates the site of supraorbital nerve. Either is a notch or a foramina. And here again use the fine gauge needle. And inject about half ml of the solution here. Press this area to minimize the hematoma formation. Now again palpate the supraorbital margin on the opposite side. Now here press it, reload the syringe, now I will block the supratrochlear nerve, because the bilateral supratrochlear nerve block will anesthetize the central part of forehead. The supraorbital will block the ipsilateral side of forehead up to the vertex, and this supraorbital nerve block the same area except the small area which is innervated by the bilateral supratrochlear nerve. For the supratrochlear nerve block, I will insert the needle near the middle, just above the medial canthus, here near the nose of the root, and infiltrate half ml of the solution. Avoid the intravascular injection. The same, reload the solution. Now I will block bilateral external nasal nerve, palpate the inferior margin of the nasal bone and puncture the skin in the midline, exactly in the midline like this. I have punctured, and infiltrate skin on either side just near the inferior margin of the nasal bone. Withdraw the needle, turn the direction of the needle to opposite side, that is on the left side, and infiltrate here. So this is the bilateral external nasal nerve block. This will anesthetize the whole of the tip ossopurative area of the nose. Now the last injection is to infiltrate the nasal spine here, insert the needle and go down up to the bone base of the spine and inject half ml of the solution. Now I have used half ml to block the each nerve. Now I will repeat the same block. This will boost up the analgesia time and of course the depth of analgesia in the distribution area. So the same I will repeat just to boost up